panic disorder in children. Symptoms: fear. How can I treat? In order to understand how to stop a panic attack, it is important to understand what one is. A panic attack is caused when too much adrenaline enters the body. Some occasions call for this rush of adrenaline, since this is the hormone that improves the body's response to emergencies. The brain senses an emergency and sends a message to the adrenal glands to send adrenaline pumping through the body, which in turn raises heart rate, and opens blood and air vessels. Adrenaline is fully in place in about 3 minutes and remains there until the body releases the emergency signal, at which time the adrenaline burns off and the body returns to normal conditions. Panic attacks occur when the body sends an emergency signal in improper situations, or is unable to shut off the signal when the emergency situation has ended. The body continues to produce adrenaline, and can cause elevated heart rate and breathing, sometimes leading to hyperventilation. Many who suffer from panic attacks claim that, in that moment, they feel as though they are going to die. What are the symptoms of panic disorder in children? The symptoms of panic disorder in children are similar to those seen in adults, including sudden fear and extreme physical discomfort without a clear environmental trigger. Children reporting on their own symptoms are more likely to talk about the physical, rather than emotional, aspects of panic disorder, and this can make it harder to diagnose. Historically, panic disorder in children has been underdiagnosed due to beliefs that children don't get it or to confusion about how the symptoms present. Children with signs of panic disorder should be evaluated by a psychologist or psychiatrist. The physical symptoms of panic disorder in children include an elevated heart rate and feeling that the heart is pounding, as well as hot flashes, sweating, shaking, nausea, and dizziness. Emotionally, children may experience fear and can disassociate, feeling like the world around them is not real. If these responses occur in response to a specific and predictable exposure to something, the child has a phobia, not panic disorder. If they appear random, it is a sign of panic disorder. Children can have panic attacks at home, at school, or in settings like the doctor's office. They may express anxiety about an event or situation, but are more likely to talk about feeling physically unwell. Panic disorder in children can also come with comorbidities, just as it can in adults. Children can have depression, bipolar disorder, and other psychiatric conditions. These may complicate the panic disorder, and it is important for children to be thoroughly evaluated to check for signs of other psychiatric issues. Simply diagnosing a child with panic disorder may not be enough, and failure to provide treatment for other conditions may result in a worsening of symptoms. Treatments for panic disorder in children often start with medications to help children manage their panic attacks. Therapy, where the patient talks with a mental health professional, can also be beneficial. The therapist can identify and explore specific sources of anxiety, as well as providing children with coping tips and suggestions like breathing exercises. Children may also need to be accommodated at school with things like a quiet room to calm down in when a panic attack appears to be developing. Panic disorder in children can continue into adolescence and adulthood, and it is very important for people to get treatment so it does not become disabling. Untreated panic disorder can interfere with performance at work or school, and may also be associated with physical ill health such as weight loss caused by feeling too anxious to eat. How can I treat panic attacks in children? Panic attacks are brief periods of intense fear, accompanied by a variety of other physical symptoms, and they are often a sign of an anxiety or panic. Panic attacks in children can be very confusing and scary for both the children and their families. Doctors agree that treatment for these panic attacks is important, so they do not lead to further psychological or even physical conditions in the future. Treatment for these attacks can include psychological counseling and, in more severe cases, medication. Children who experience a panic attack may seem to be suddenly upset or frightened for no apparent reason. Also, panic attacks in children are generally accompanied by physical symptoms, such as heart palpitations, chest discomfort, shortness of breath, trembling, nausea, or vomiting. Any or all of these symptoms are not uncommon during a panic attack, and they can seem extremely overwhelming and scary. These attacks, however, usually gradually subside, and most attacks will not last more than a few minutes. If they are not treated, Panic attacks in children could possibly lead to more serious medical complications down the road. A child who suffers from panic attacks at a young age may develop intense irrational fears, or phobias, in the future. Agoraphobia is the fear of public places, and it is believed to be associated with panic attacks. Children and adolescents suffering from panic attacks may also develop a predisposition to developing heart disease. Psychological intervention is often used to control panic attacks in both children and adults. Individual and family therapies are often used to help individuals and their families understand and cope with the disorder. Group therapy can give children suffering from panic attacks the ability to share their experiences with other children suffering from the same disorder. During these types of therapy sessions, children can also practice skills that may lessen the symptoms or even stop panic attacks. Cognitive behavior therapy is one of the most popular treatments for panic attacks in children and adults. Some doctors describe it as rewiring of the brain. This therapy teaches skills that reduce anxiety. Children who suffer from these attacks are coached to recognize negative thoughts and feelings. Therapists then help the children think of more positive thoughts. At times when psychotherapy is not enough, a variety of medications are also prescribed to children suffering from panic attacks. With careful monitoring, these medications combined with counseling may reduce, or put an end to, most panic attacks in children. Many antidepressants, such as Zoloft and Lexapro, can help keep the symptoms of panic attacks at bay. Sometimes, tranquilizers, known as benzodiazepines, are used along with antidepressants to treat short-term severe symptoms. Treating panic attacks in children does not end in the doctor's office, however. Doctors agree that there are a few things that families and teachers can do to help a child cope with his disorder. During an attack, it is important for a parent or caregiver to stay calm. If the caregiver is upset, there is a good chance that the child could become even more upset. Encouraging a child to talk about his feelings and listening is also important, and some doctors recommend doing relaxation techniques together. Panic attacks at school can affect a child's ability to learn, and may even lead to a learning disorder. Parents should inform their child's teacher of the disorder and, if possible, devise a signal that he can give to his teacher if he feels an attack coming on. The child can then be moved to a less stressful environment, and it could eliminate a potentially embarrassing situation. How common is a fear of children? Pedophobia, or a fear of children, is extremely common in many societies, though in varying degrees. Many people develop a fear of children because of the popular notion that crime rates will rise with any rise in the population of children in a given area, while others develop a fear of children because of child-rearing responsibilities, an inability to connect with children, or a dislike of children because of their communication methods and mannerisms. As a widespread phenomenon, the fear of children has been perpetuated by various media through movies, television, and writings on the subject. Widespread pedophobia has become an international issue and now focuses on maintaining the safety and quality of life of children throughout the world. Experts argue that a fear of children can lead to abuse of children, particularly in less developed countries. In more developed parts of the world, pedophobia presents its own sets of problems, including a devaluation of the life of a child, child abuse, and difficulties concerning rearing a child in some societies. Many people who fear children view them as a liability and a nuisance, and they believe children can only detract from the quality of life of a society. Some people suffering from a fear of children have developed an irrational fear based on perceptions presented in popular media. Horror movies regularly feature evil child characters who seem to have no moral compass. Other types of films and television shows present children as mischievous, lacking social tact, or overly aggressive and wild toward peers and adults. While many children do, in fact, possess some of these traits, the overstatement of these traits in media can lead to an irrational fear of all children, most of whom are actually quite vulnerable in reality. Many methods have been suggested to work towards overcoming pedophobia. Severe cases of the phobia should be treated by a professional, while less severe cases can be treated by taking simple steps toward familiarizing oneself with children and children's issues. As with any phobia, Understanding the cause of the fear of children is important and overcoming it. Most people who develop a fear of children do so because of a negative past experience with children or children's issues, and understanding that cause may help alleviate the fear. The most severe cases of pedophobia can lead to violence toward children, and such severe cases should be dealt with immediately both by professional mental health specialists and law enforcement agencies. Fear of children is important and overcoming it. Most people who develop a fear of children do so because of a negative past experience with children or children's issues, and understanding that cause may help alleviate the fear. The most severe cases of pedophobia can lead to violence toward children, and such severe cases should be dealt with immediately both by professional mental health specialists and law enforcement agencies.
I hope you enjoyed our review. If you would like to order this product or see further details, then simply head over to the website address you see on the screen right now.